Greetings! Today we are going to learn about the infantile subdivision of Batten disease. I hope you enjoy. Starting off with its definition, what is Batten disease specific to infants? It is an extremely rare and fatal autosomal recessive neurological disorder. It is one out of the 50 NCLs, which is neuronal ceroid lipofuscinosis, which are basically diseases that have to do with the dysfunction of the lysosome. The lysosome is an organelle within the cell body that is in charge for removing waste. What are the general characteristics of this? Well, Batten disease that affects infants. The infants are born completely healthy, and starting around 8 months old, their developments start to slow down. They have trouble sleeping at night, they have repetitive hand movements and fiddling around, and they become super floppy, super dependent on someone to have them walking, standing, and their speech can get lost. So, now that we have generally explained what Batten disease is, let's go into some of the symptoms. For starters, seizures are always present as a symptom of this disease. Another disease can include blindness or visual impairment. A patient can experience personality and behavior changes, dementia, memory loss, the loss of motor skill. This disease is fatal, so if someone is diagnosed with this, there is no way of curing it. Since we are talking about babies here, when do they first start developing this disease? Starting at about 8 months old, a parent can see their baby beginning to have a psychomotor delay, and at about 16 months old, they can experience a lot of myoclonic jerks, which are basically jerks in the muscles. And starting at 18 months, the baby will do this repetitive hand motion, kind of like it's knitting, which is known as hyperkinesia. Let's talk about the causes. Now, the main cause is genetics. All genetics here. The gene SLN1, which lies on chromosome 1, can be inherited by two parents that are unaffected carriers of this gene mutation. Since I have mentioned that this is an autosomal recessive gene, both parents have to be unaffected carriers, meaning that they carry the gene, but they aren't affected by it. This SLN1 gene can direct production of a lysosomal enzyme called palmitoyl protein thioesterase 1, or abbreviated PPT1. And this, a deficiency in this PPT1 can result in abnormal storage of proteins and lipids, which can lead to cellular dysfunction. So let's go over into how a patient is diagnosed with Batten disease. Now here we have 3 different distinctive forms of deposits that can be found within the tissue samples that doctors will take. There are lipopigments that build up in the cells due to the lack of the lysosomes working properly. There are 3 types: the curvilinear, which look like half-moon shapes, almost like commas, the fingerprint inclusion bodies, which look like fingerprints, and the granular ones, which are called G-rods, or granule osmophilic deposits. Looking under an electron microscope, a doctor can see these lipopigment deposits, and this will help the doctor decipher if this is truly Batten disease or not. Batten disease is extremely hard to diagnose since it has some symptoms that are commonly found in other diseases, such as seizures. So that's why it is often misdiagnosed. For example, since one patient can become blind, a doctor will take an eye examination, and it can help them to direct them into diagnosing Batten disease. But since so many diseases have blindness as a symptom, it is very hard to diagnose Batten disease. Common tests that are done include blood and urine tests, electroencephalograms or EEGs, brain scans, DNA tests, of course, since this is a genetic disorder. Family history is searched up, and enzyme assay, which is a laboratory method for measuring enzymatic activity, since the lipopigments that develop really affect the enzymes that go into the dysfunction of the PPT1 protein. Let's go into how to treat it. There is no exact cure to this disease. There are only ways to ameliorate the symptoms. Some things that have worked for patients include controlling the seizures with anti-convulsant drugs. Also, patients have shown their symptoms to ameliorate when they are treated with vitamin C and E. They have found that those vitamins have preventing the progression of the disease and the severity of the disease. There has been drug therapy done, and currently researchers are experimenting with different types of animals, such as mice, to find specific drugs that help ameliorate the symptoms of this disease. For example, some scientists have concluded that the drug hydroxylamine that they can change the molecular structure of this drug to make it into this, which is short for enter-butyl hydroxylamine. And they have tested this new constructed drug into a strain of mice that have been found with this disease. And they have found that it has protected the neurons in the mice's brain. It ameliorated the motor coordination that can deteriorate with this disease. And overall, this drug extended the animal's lifespan. Overall, scientists are looking into drugs that will help people with this disease. Gene therapy has also been done, in which their doctors have found a way to correct a copy of the faulty gene into the cells to make them function properly. A stem cell therapy has also been tried with patients, and this approach delivers cells that can make the correct version of the faulty protein. There has also been enzyme therapy that can deliver enzymes directly to the brain. And on a general basis, doctors are going into storage material degradation and trying to ameliorate that. And by doing so, they have found this one drug called cystogen that appears to help cells break down the storage material that the lysosomes aren't doing. Let's move on to prognosis. As I mentioned earlier, this disease is completely fatal. Since doctors are still researching into it, there is so much that they don't know. This illness does not affect the two children exactly the same. It is very specific to the person. There is no timetable, although the lifespan of those diagnosed with it is very short. For example, the infants that are diagnosed with this only live up to their mid-childhood ages. About the age of 3 years old, these children become completely dependent on their parents and their caretakers. They have a feeding tube, and their arms and legs usually become stiff. They're unable to walk. They need help communicating and moving. So now that we have gone over this sad and unfortunate prognosis, let's go on to a few statistics. This Batten disease occurs in 2 to 4 of every 100,000 births in the United States. So as you can see, this is a rare disease. However, this disease is found more commonly in Europe, such as Finland and Sweden, and also in Newfoundland and Canada. That is all I have for you today on the infantile subdivision of Batten disease. I hope you learned something new today about this devastating disease, and I thank you for your time.